How do you think we make Medicaid policies more effective in supporting youth mental health?
Well, the first thing I will say, because we're in an environment where, Medicaid cuts are on the table. So I don't want to forget to say, because it is
This
really
may not
top
be
of
possible at
mind.
all.
No. I think step number one is making sure we don't take a step back. I think that we have, Medicaid, as we've already talked about, and you both know, is so critical to children being able to access and address their behavioral health needs. And right now, with the size of cuts that we see being discussed at the federal level, those will have an impact on what states are able to provide under their Medicaid programs. If there are significant cuts to the Medicaid program from the federal level, that goes to the states, and that affects what states are able to do. States already, as you both know, have to make tough decisions. How are they going to prioritize? Where are they going to put funding? And, there are states that have done things to address children's mental health. Will they be able to sustain those? Will they be able to grow those if there's cuts coming down from the federal government? So I think the first thing is we need to make sure we don't take a step back working together because of the role Medicaid plays across the board, but because the really critical role it plays, especially for children who have behavioral health needs.